Let's bring in Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He joins us most Wednesday mornings at this time. By the way, our Black History Month series will be with you in just a couple of moments. Joe, you want to go to another issue for us in regards to a different labrum, right?
Yeah, Ray. A lot of people aren't aware of the fact, with all the talking ad nauseum about the labrum in the shoulder, and rightfully so. It's become an injury in the shoulder that's much more common, even for our younger athletes, high school athletes, college athletes, but also growing just as fast, maybe faster, in the last 10 or 15 years is an awareness of the labrum in the hip labrum. And so this cartilage hip labrum saucer that holds the ball and socket together. The ball and socket of the hip is a lot deeper than the one in the shoulder. And so in the last 10 or 15 years, because we now have a pretty good surgery for it, it's the thing that we look for quite a bit more, and we're finding it quite a bit more in athletes, and trying to fix them early so that we don't go on to the real big problem from the standpoint of prognosis is in the old days when we didn't have surgery for it 20 years ago, 25 years ago, we didn't look for it much, was a lot of those people went on to having to stop activities in sports, go on to arthritis in the hip, and some of which had to go on prematurely to having a hip replacement surgery done. And so it's kind of encouraging that we know what it is, and it's very encouraging that we have a good surgery for it. And here in Akron, we have several surgeons who do a very good job fixing this torn labrum in the hip. But the population of athletes that we see it in very frequently are dancers. And we have a really well-developed dance population in Akron, Ohio. And these people, these young athletes are aesthetically beautiful, great jumps, strong lower extremity, very great strength. When you want to get people going and irritated in a clinic like ours, is start telling me that dancers are not athletes. They're wonderful athletes and great athletes. And in a place like Akron, Ohio, at Children's, 10 to 12% of our patients are dancers, and so it's very common. The mechanism, though, of how it happens, everybody now is kind of well in tuned in the shoulder. It happens when the shoulder is dislocated. And so as the ball pops out of the socket in the ball and socket of the shoulder, it tears that cartilage pad in between known as the labrum, which part of the role of that labrum is to hold the ball in the socket. And same thing in the hip. It's a deeper socket. It's a thicker labrum. We don't get dislocations in the hip nearly as frequently. So the mechanism is more jamming the hip and then twisting, and then they feel a pop in the hip. That's the classic mechanism. And it's seen frequently, by the way, in our football players, soccer players, basketball, with a lot of cutting and pivoting where you may jam that hip, twist it, and you feel a pop, and then pain, catching, locking, pain that just won't go away. They come to see us. Even sometimes with physical therapy, they're not getting better, and then we get suspicious of a labral tear. In dance, so much of it is landing and rotation, a thing called turnout, that at a very young age these dancers do a lot of turning out or rotating the hip, and that can lead to this problem known as torn labrum. And in dance, just for people's knowledge about it, there's all sorts of different types of dance, and we see dancers tap, jazz, ballet, modern, lyrical, Irish dance, and of course ballet is kind of near the top of the list for developing this torn labrum in the hip. So it used to be kind of a thing that ended careers, and now because we have a good surgery, mainly arthroscopic surgery in the hands of a surgeon that has a lot of experience, this can be fairly easily fixed, and kids can be back very much like the labrum in the shoulder in a matter of 4 to 6 months in many cases. The problem in diagnosing it is it's harder to see than the labrum in the shoulder. So we often have to inject dye when we do the MRI. It's by MRI only, but when you inject the dye, you can see where the tearing in the labrum is, and that's called an MRA, an MR arthrogram, and that's how we have to diagnose it with this dye material. And the first line of treatment is physical therapy. Many young athletes get better with PT in 3 weeks, 6 weeks. they get better, maybe not perfect. They still feel some catching occasionally or giving way a bit, but they can get back to their sport and do well with it. But in those that just don't get better with physical therapy, we're 2 months or 3 months, then we often have to do this MRA to see if they have a tear. And because of the fact we certainly don't want them to go on to early arthritis, hip replacement later, it's something that we as sports medicine doctors, particularly with young athletes, don't want to have linger for years at a time, because that's really what can beat up a hip pretty badly. Historically, you may remember the great athlete Bo Jackson had a kind of hip that had a loss of blood flow to the hip, and it ended his career. And in Cleveland history, there was a guard that we traded for a few years ago in Boston by the name of Isaiah Thomas, who had issues related to hip impingement. They call it pinching of the hip and torn labrum of the hip. So it's a pretty common problem. It's getting to be more common. We have good things to help treat it and fix it and recognize it, but it is one of those injuries that's surprising to people that, oh no, we don't have just a hip in the shoulder. We have a labrum in the shoulder. We have a labrum in the hip, and it's very important to keep it healthy for young athletes.
Real good education this morning, Joe. That was really good stuff. Thanks for the time, certainly the time spent putting that together, and we'll get back together next week. Thanks, Joe.
See you next week, Ray. Thanks.
You got it. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital.